And we're all set. So good morning again, everyone. Thank you so much for participating in the White Plains City School District Reopening Committee. This is an important committee. I want to thank all of you who are returning and also welcome those of you who are new. The purpose of this committee is to consider collectively health safety mitigation strategies associated with the COVID-19 pandemic. And now, of course, what we're contending with is the variant, the Delta variant for COVID-19. Now, I had just made mention that we are definitely in a better position, better by terms of obviously public health, but also better in terms of planning, a better position than we were last year at this time. The bad news, if there is any bad news, of course, is that we've not yet received concrete guidelines or new concrete guidelines from the New York State Department of Health. There is a lot in the news. Obviously, everyone's watching the news and keeping up with what's happening related to the Delta variant. What we are seeing is we are seeing increased cases of COVID-19 and the variant of COVID-19 primarily in unvaccinated populations. When we do see breakthrough cases, we are seeing that vaccination greatly, as was, I don't want to say predicted, but as was assumed, we're seeing far fewer people, fortunately, far fewer people needing to be hospitalized, and of course, very fortunately, far fewer deaths. So that's good news. Of course, you lose one person, that's horrible, but at the same time, much, much different than where we were last year. But that being said, we still have a significant portion of our population that is ineligible for vaccination. As you know, right now, children ages 11 and below are not presently eligible for any type of vaccination for COVID-19. We also know that children ages 12 and up are kind of not necessarily, and folks, we could understand this, not necessarily engaging in the vaccination process as, let's say, readily as adults in sort of the higher risk category, higher risk age groups. And we're also sort of hitting a wall with adults who can be vaccinated, but who are choosing not to. And therein, of course, lies the challenge, because the more opportunity for the virus to spread, the more it will spread. So as we're approaching this academic year, let me kind of lay out where we are right now in Westchester County. We met yesterday with the county executive and his team, as well as the superintendents from all of our regional school districts. The Westchester County numbers, while they are increasing, are still relatively, I would say, low. And certainly the coincidence of folks being hospitalized, again, equally low. That's good. But we also know that we need to make sure that we're taking the appropriate steps to ensure that as we approach and get into this academic school year, that we are maintaining what I'm tooting your horn, certainly not mine, maintaining that very strong and effective measure and method of reducing potential spread within our school facilities. And we did a great job with that. And so we're going to want to try to continue in that effort. Of course, this year, we're thrilled to be welcoming back all of our children 5 days a week, typical schedule. All of that is in the works right now for our school year. So that's great news for our kids. It's great news for our community. We are awaiting updates related to the state's requirements for health safety mitigation, but I am going to suggest to you today that we consider following what we know has worked for us in the past. So first things first, right? So the school year right now is going to be a typical school year, 5 days a week, right? Regular school day. We are anticipating activities. We are anticipating after school opportunities. We are anticipating athletics. We are anticipating the arts, all of those great things. There may be some meetings that will continue to be virtual. I'm thinking like evening meetings, things of that nature, but we're still trying to work out and trying to have as many in-person events as possible while maintaining health safety standards. So as we're approaching the academic year, we know that we're not going to be able to offer full remote as an option. For parents and guardians who have a medical situation, we're going to encourage them to reach out to us, to reach out to our principals, to talk us through whatever's happening, and we can work with health services to try and assist those families. That is a very, very, very small number of families in our school district. What's different this year, of course, is that we didn't have the ability to bring all of our children back in September last year all together, all at the same time. We had all of those density reduction requirements. So we're really glad to be in that position. The big question that is out there in the country, but maybe not as big of a question here, is whether or not children and adults should be wearing masks while in the school facilities. Now, I think, based on what I'm seeing and based on what I'm hearing, that is going to be a requirement in the state of New York. We see CDC's recommendations when you're in the school facilities to wear masks. When you're on transportation, obviously wear masks. We're also seeing the American Pediatric Association wear masks. All of the same things. So there are sort of two areas where there's broad agreement. Get every kid back into school every day in the country, and mask up, both vaccinated folks and unvaccinated folks. Now, I know, we don't like wearing masks. We don't like to see each other's smiles, like to see the kids' smiles, all those things. Of course, I think we're all in agreement on that. But if the mask is going to help us reconstitute a typical academic year, it's a small ask, in my opinion. And one of the things that folks have asked me, well, could you make masks optional? Well, optional doesn't help reduce the potential spread of COVID-19. So what are we trying to avoid? We're trying to avoid quarantine. We're trying to avoid contact tracing and isolation situations. We're trying to avoid disruptions in families' days and lives and weeks. And any way that we can try to do that is going to be advantageous to us. So I think, and I'm going to ask you what you think today, I think that at least letting our community know that the White Plains City School District is planning to implement masks as we come back in September would go a long way to assuaging, easing some parents and guardians, and even kids' concerns about coming into the facilities. So that's the big crux of what we're gonna cover today. I do have a poll, as in the past. I'm gonna ask you to participate in that poll. It's one question, yes or no on masks. It's anonymous. The only thing that I ask is if you choose no, please be willing to explain to the committee why you're choosing no, so that everyone can understand your thinking. Not to argue, but so that everyone can understand your thinking and that we can all benefit from sort of collective thinking about this issue. That again is really the primary decision that we're going to be making today. And then as more information becomes available from the state of New York, and I think over the next week or two, we are going to have information, the committee will then consider it. Now, I should mention, I want to thank you again for participating in this committee because it's no longer required. The requirement for reopening committees expired with the emergency orders that expired at the end of last year. But we believe in the White Plains City School District that this committee has been instrumental in our ability to navigate what really was, an unprecedented time. Nobody knew how to do it, right? There was no book. This committee, I can tell you from my perspective, was extraordinarily beneficial for me. So we're going to keep us going until we don't need to have the committee anymore. Any initial questions, comments, or concerns about anything that I just shared? And feel free to just unmute yourself and share away.
Dr. Ricker, for the survey, the one question survey, is that masks on school campus, indoor, outdoor, the whole thing?
Yeah, great question. Thanks, Mr. Cameron. So it's masks for all, regardless of whether or not you're vaccinated, while indoors in school facilities. So when you're outdoors, we know now, we know solidly right now that COVID-19 does, and the variant doesn't do well outside. That doesn't preclude folks from wearing masks outside, but we're thinking about recess and the like, and getting kids a chance to take breaks and all of that, physically distanced, and doing all the things we know how to do. So Matt, it's basic, it's really inside that we're looking at right now.
Thank you.
Yeah, absolutely. Hi. Hi, Lee.
Dr. Hi, just a quick question or comment actually about the outside mask. I just wanted to share that. I don't know, it might change, but I know the kids aren't supposed to be wearing masks outside, but I think we want to consider still mitigating, doing some kind of distancing, because the very last week of school, sure enough, my daughter got sick outside, had an ice cream party. And fortunately it wasn't COVID, but you know, kids are close, so things spread. So I just want to throw that out there. And then also just a question on, I know we're doing full in person, which is awesome, but on the back end, are we planning for hybrid just in case things get worse? Just a question.
It's a great question. And so, yes, we have the capability to pivot to remote. We're not planning for hybrid. We're going to maintain the ability to pivot to remote in the event that, say, like a class gets impacted and has to quarantine and isolate. That's really what we're going to see, if we're going to see anything. We're going to see those groups, those smaller groups, and then we could then be able to pivot to remote for the period of time that those folks are impacted. Of course, we hope it doesn't happen, but if it does, we have that capability. Hybrid, we're not planning. We're planning for, you know, you're in the class or you're not, and that'll be the most advantageous. But yeah, we'll have the ability to do it. God forbid we need it.
Okay, thank you.
Absolutely. I saw there was a question too. Melissa asked, what percentage of the White Plains school population who are eligible are vaccinated? We don't have exact numbers. What I can tell you is from the employee standpoint, we have an extraordinarily high number of folks who took advantage of vaccination. I have to tell you, I'm really proud of that. It was a huge effort on behalf of CSEA and WPTA and ASA and all of the members of our school community. We did a great job with that. So our folks are protected. Do we have people who've chosen not to get vaccinated? We have a handful, of course. But you know, when you're talking about the percentages, we think we're somewhere in the high 80s, and that really, I see Nurse Maggie shaking her head. That's tremendous when you're looking at other types of institutions. Another question was, will barriers be required at student desks? So we took the barriers down. The barriers are still in the buildings. If we need to use the barriers, they'll be ready to deploy. But at this time right now, we don't have barriers up in the classrooms. And we think that will be advantageous as well. The science was kind of sketchy on, you know, the effectiveness of the barriers to begin with, but you'll remember, we didn't want to just pull them down last year as we were phasing everybody back in. So it didn't hurt to keep them up, but we did take them down in the classroom. I see Ms. Mungin's asking a question. Barriers in the cafeteria. Principals can certainly, absolutely install and maintain the barriers in their cafeterias. You know, that is in my opinion, a good move. You're going to be eating food and talking, and you know, that's an area where, and just like Lisa mentioned, it's not just COVID-19. I mean, everybody, you might even know this, like this summer, everyone's got this horrible, nasty summer cold. And that's because, you know, people are now together again a little bit more. And while fortunately they're not catching COVID-19, they're catching a cold again. You know, they're getting their normal strep throat, pink eye, all that stuff. And, you know, we deal with a lot of communicable illnesses in schools to begin with. And so, you know, in the lunchroom, that can definitely be advantageous. Great questions. Somebody had their, oh, hi, Rosemary.
Yeah. Good morning. Good morning, everyone. Quick question with regard to the masks outside. Is it fair to say that, you know, we'll look and see how things do with the highly transmissible variant, and if we could, you know, we would use that data to inform us in terms of, hey, let's get some masks on outside, because, you know, the data is telling us that we need to do that. Would that be fair?
Oh, I think absolutely. I think that's the way to go with outdoors. You know, for today's question, we're really considering indoor. You know, as everybody, or I shouldn't say everybody, as most folks may know, we have tents up at all of our facilities now. We're really going to be trying to utilize, as we did last year, the mild weather to get outside when possible, and, you know, take mask breaks and all that. But we also want the kids to be able to run around. So I think, Rosemary, I think that's a good approach, and we'll be, you know, obviously we're going to be monitoring everything as we did last year as well. I know Nurse Maggie's really psyched about that.
I just wanted to add that we are going to be changing. We're going to be changing everything as we get the information. So, you know, if we have to mask up outside, we may have to change that. If we have to put the barriers back up. But remember, the only thing that we really want to do is prevent us from having to quarantine and isolate so that we can have the kids in school as long as we can have them in, so that we can make sure that they get educated as best as they can. So the name of the game is for us to just really change the rules as we see the information. And we're going to be very vigilant with doing that.
Yeah, absolutely. I see another question, Rob. I see your hand. I see another question too from Laura. Will we be able to mix cohorts, for example, 2 grades in the cafeteria at the same time last year? Yeah, I think we can. I think we're going to need to just, you know, make sure we know who's where, you know, all that time, as you guys had done, as you folks had done. But I do think that we're going to be able to do those kinds of things. And again, masking will help with that. And then, of course, when children are outside playing, the incidence rate does drop dramatically, but we will have to monitor.
The other thing is, I just want to make sure that there's seating assignments. You know, if you're gonna have kids sitting like, you know, 1st grade and 2nd grade, have them as separate as you can and have seating assignments. I think it's going to be key because, you know, if you don't know where they're sitting, you're going to be quarantining many kids, and we really want to prevent that.
Yeah, and you'll remember some of our schools did a really neat thing for the older kids last year. We had the QR codes that the kids could scan right into wherever they were, and that was really quite innovative and helpful in terms of being able to contact trace. And like Maggie said, the goal here is to minimize disruption. So we want kids in the start of the school day and then send them home happy and healthy at the end of the school day, 5 days a week. That's where we're, you know, we're focusing right now. Go ahead, Mr. Janowitz.
I think part of our success last year in all of our buildings is that I think we did such a great job maintaining the less cohorting and mixed kids. Like, to me, it would make sense just listening to Maggie right now. Like, we've created an environment last year where we didn't have to mix kids in a real efficient way, just to reduce the amount of having to quarantine. So, you know, I feel like we're in a really good position where we could pivot in either direction.
Great.
But starting in a sense, Maggie, I don't know if you want to chime in, starting in a sense where we would have less cohorting in terms of mixing kids to start off with, in terms like in the cafeteria, having 1 grade there at a time, not having multiple grades, not having multiple grades in big holding areas, because we've already designed programs to not do that, systems to not have that. To me, that makes a lot more sense to start out the year. I just wanted a little feedback on that. And what does that mean for visitors in the building? Are we still having student teachers and parents and families and, you know?
Yeah.
Just a couple thoughts.
Yeah, no, good ones. And I think, again, you know, and thinking about your building, and this goes obviously for all the principals and teams at the building level, you know, thinking about those systems that you had in place last year that worked, if you're able to implement them, if it works for your facility, works for your schedule, I think, you know, trying to be as conservative as possible at the outset certainly would probably be advantageous. In terms of visitors, we are going to try and maintain a lower number of visitors in the buildings as we have, at least at the outset. You know, so we'll have that similar situation set up. Student teachers, we will have student teachers this year. By and large, student teachers are going to be folks who are vaccinated. And, you know, again, that's part and parcel of much of what's required at the college level. So we will have student teachers in our facilities, but yes, visitors, will try to minimize that again during the school day. Just again, everything is in an effort to not disrupt the full school day. And I know, you know, for moms and dads who are watching this later on, I know that's your goal too. We need our children back in school all day long. So that's kind of where we're pushing, and I think all of those strategies that were successful for us in the past, we can employ them again. I don't see any downside to doing that. Any other questions? Oh, Laura?
Thank you. I just want to speak to the first days of school for the elementary. Usually we have kindergarten parents who are really eager to walk their little ones to class on the first day of school. And we have made that available to parents, in the past, just as part of kind of the new school experience. Given, where we are right now and the unknowns, we're not going to be allowing, 100 parents or pairs of parents to come in and escort their children on the first day. So I just wanted to kind of say that out loud so that everybody can hear it and understand the thinking behind that. We will each have a meet and greet before school opens, where parents will have an opportunity to come with their child to meet their teacher and visit the classroom. So I encourage new parents to take advantage of that for our kindergartners, because it just won't be possible on the first day.
Yeah, thanks, Laura. That's an important point, and in a very, in my opinion, a very intelligent decision. And I think most moms and dads, if not all parents and guardians, would certainly understand that. We'll still be able to send the little tigers off with a big hug and everything, but outside of the facility. And again, just attempting to minimize to the extent possible any potential for disruption. So thank you for that, Laura. Definitely. Hey, Laura.
I was just thinking about the cohorting, and last year at the high school, we had 2 separate lunch periods, which we had never done before. We'd always had like everyone, teachers and everybody eat at the same time. So how has that's something to think about, just how we're going to do lunches at the high school with so many people.
Yep. Mr. Martinez, I don't know if you want to.
Yeah, so good morning, everybody. Yeah, so that's certainly a conversation that we are having, and in fact, I was just texting Mr. Vidiello to let him know. I think we need to work with our team and get our building level reopening committee together, see who can join us this summer to have that conversation. And certainly I'll invite you as well, Lola, to be part of it. Rena, I know you've been part of it in the past as well. Right now, a couple of things we have done already is while we were planning, for a 1 lunch period, we have worked with food services to increase areas for students to get their lunch. So we're going to have additional kiosks in different spaces. Certainly, we're going to work on tweaking how we do that contact tracing, right? So we know where students are sitting. So even if we are using, some of the lobbies where some of these kiosks are, that perhaps we'll be able to have a QR code there so they can identify if they're in certain areas. So we'll definitely be exploring those things. And one of the other things that we're going to do is we are going to be looking at opening up the campus to not just our seniors, but to our juniors as in the past. But we will have a closed campus for our other 2 lower grades. And that will also help alleviate some of the congestion in some of the lunch areas as well. So we're absolutely looking to make those tweaks to make it better than it was last year.
Thanks, Mr. Martinez. So I can just give a plug also to food services. I know there's some amazing things happening in food services right now in terms of the choices and the selections that our students are going to be able to take advantage of. So that's exciting stuff, as well as, the comfort level. And at the high school, for instance, looking at what types of spaces children can use, and kind of creating more of a coffee house atmosphere in some areas of the high school. So that's going to be pretty cool. I see Mrs. Lyons' hand, but I also see a quick question from Mrs. Marino in the chat. The question is, any change to the quarantine rules? No changes as of today, as of right now, but we do know that there have been some changes in the CDC recommendations, and there's an anticipation, Patricia, that may be adopted also at the state of New York level as well. Kara, morning.
Good morning. It's great to see everyone, and that we are so much better positioned here in August than we were last year. We have so many tools and things that we're ready to do, systems in place. I just wanted to bring up, thank you, Emily, for bringing up the idea of bringing back the building-based teams for folks who are available, because I think it is an important conversation to have with all different stakeholders at the building level. There are a lot of things that we might want to keep in place. I think we've implemented some really good practices, and it's really important that we think about how everyone is doing, right? Students and staff, and keep that in mind. And I think a building-based committee can keep an eye toward that, and also maybe have some good innovative ideas about keeping folks safe so we can be in person all of the time. Thank you.
Thanks, Mrs. Lyons. Any other questions, comments, concerns? All right, poll time. Oh, Ms. Munch.
Sorry, I keep doing that to you. My brain is always processing. As we think about the possibility of moving back to 6 lunch periods, do we have some flexibility in terms of our cafeteria recess monitor hours? Because we may need more coverage on either end if we're going to go back to 6. So last year we were able to add another hour. I don't know if that's something that we can do again.
Yeah, we could absolutely take a look at it. So, when you have an idea of what you may be looking at and what you want to need, just let us know. Sound good? Great. All right, poll time. Everybody get ready. It's a big one. Do you support masking facial coverings for all indoors? Anonymous poll. 27 participants, 48%, 50%. 24 of 27. Okay, 27, 100% participation with 20 seconds. That might be a record for this committee. Thank you very much. Here is the results. You have 26 folks, 96% say yes. One individual says no. I did make mention of if you would be willing to share your thinking, if you on either way, yes or no, if you disagree. Because it's one person, I don't want to put you on the spot, but if you do feel like sharing what your thinking is, please do. All right, I abbreviated my teacher wait time, so I appreciate everybody participating in the poll. So right now, the reopening committee has agreed by majority that we support masks and facial coverings for all indoors. This is good news in the sense that we know that this will help to stem the spread of all communicable illnesses. It's not 100% fail-safe, but certainly will help us to to maintain as best as we can that safety, especially for folks who are unvaccinated, especially for children who may live in multi-generational households, or folks who may have health concerns. So that's helpful. I can also share with you that my understanding is in the majority of the school districts in our region, reopening committees are also looking in the very same direction. So White Plains, by no means, in my estimation, will be alone in having masks, at least at the outset, at least at the beginning of the year. Lola?
Just a question that popped into my head. If like a student gets contact traced for a reason outside of school, like they got in contact with somebody that is unrelated to school, is hybrid going to be an option for those students that need quarantining?
Yeah, great question. Thank you. So no. Imagine if you had contracted like mononucleosis or chickenpox or any of those other illnesses that are pervasive and they're around and you have to be out sick. What we will do is we will implement the same thing we would do if you're going to be out for a period of time in terms of getting you to work, coordinating with your classes, but a whole scale remote system isn't going to be in place in this academic year. Great question, Lola. Any other questions?
Hi, this is Patricia. I just have a quick hi. Thank you, everyone. Nice to see everybody over the summer. I voted yes for masks because I know that that's the climate, and I wasn't the person who voted no. But I do think that we should be mindful of the fact that we should continuously pay attention to the science. I mean, in reality, I know people are getting a lot of their news from mass media, and they're very much pushing masks. But if you look at the data, masks are not as effective as we once thought. And I do think that some children are getting a lot of other illnesses and related to masks. I can speak for myself. My daughter, who's never had an ear infection, had 4 this year, probably related to the mask because she's not draining and so forth. So I think we should continue. I'm in support of the mask at this point because of the variant and the numbers going up. But I do think this should be a continuous conversation because I do think that sometimes the cost benefit analysis isn't as clear as what the media presents.
Yes, great point. I would urge folks to definitely rely less on, cable news and more on CDC, APA, WHO, your old family doctor, those sources. Absolutely.
You should look at the research. The CDC, not 100%. You look at the research studies.
Sure. Yeah, nothing's 100%. And I think you're right. I think also we should absolutely monitor all of these health safety standards that we have in place all the time. Again, agreement with you, so that when we can, because I know we all want to, we can move out of some of these areas, like facial, like masks. We can't wait until we can put those down for sure. Thanks, Patricia. Lisa.
I'm sorry. Lola had a good point, and that I just want to, she made me think, like Ms. Mungin said, it just, as she was talking, it made me think, I have a senior, and if she had to quarantine for 10 days and make up work, that would be impossible. So I'm thinking it might be smart to have the remote option if kids are home, because I do.
You froze, Lisa, but I think I have the. Oh, go ahead.
Quarantining is just a step away. It's not going anywhere, unfortunately, and available in case they do have to quarantine. Hear me? I was saying, I think that we're putting kids at a disadvantage by not allowing them remote if they are home sick, because it puts them 10 days behind schoolwork.
Right, it's a great point. So the idea would be, certainly if they're sick, if they're not well, God forbid, we're not expecting them to be at the computer every day, right? They're sick. But if they're quarantined and they're okay, we're not expecting that they're going to wait 10 days and make up 10 days of work. It's the coordination with their classes and with their teachers. Much of the work is already based in the student information, student learning, and management systems, and they'll have access to that. But frankly, just so everyone on the committee knows, we don't have the capability to just be remote. And I know that's not what you're saying, Lisa, but just be remote all the time. So it's not like it's a choice. We absolutely have to get our educators and our support staff members 100% focused on all of the children that are in front of them every day. If we do encounter something that we're not anticipating, like to your point, Lisa, we're seeing, quarantines spiking or something of that nature, we will absolutely, can come back together and pivot and do whatever we need to do. But just in terms of planning for parents and guardians, I think it's important at the outset just to let everybody know that the expectation is that all of our children will be in every day. But it's, again, really great point, Lisa, and I certainly hope that we can avoid those types of situations with our kids. Thanks. Mrs. Lyons. And I see you're next, Lola.
Hi, so I just wanted to connect back to Lisa because I was sharing this with Dr. Ricka yesterday about how, I think about my 9th grade daughter and about like what missing 10 days of math would be. And it really makes me think about, the choices we're going to personally make too, right? And the level of risk that we're going to take. And I think this is where the building-based committees are going to be really important in thinking about systems to support students, because it's a slippery slope once we open up like, oh, we're gonna do hybrid when students are sick or students are out. It also creates a situation where some of our students might not willingly be home. Meaning like they might be, babysitting or using other things. And I think if we can get a system to support our students who are out and remote, whether that's looking at our platforms or homebound instruction or designated teachers to support those students, I think that's great. And I think that's something that we can look at the building levels, because that is a really great point. So thank you for bringing it up. But I do think that hybrid instruction has so many challenges that if we can keep it clean and implement something else, I think we can be in a good spot to support students.
Thanks, Kara. There is, just so you know, and we're looking at it, we've not made any decisions about it, but there is a remote school BOCES shared service that exists and has existed in the state of New York. I wasn't aware of it until last year. And I believe it's in one of the upstate BOCES, but if need be, you know, that's something that we could always look at if we had to. I think Kara's point is very well taken, you know, at the building level to be able to coordinate and then support children who may be caught up in a contact trace or something like that. And I also want to share in the same vein, if a parent or guardian is watching this and saying, you know, I have a really extraordinary situation at home and, you know, I can't send my child to school, please reach out to us as soon as possible so that we can assist and get all of the supports available to you as well, and do that sooner rather than later. I always, before we wrap up, I always want to make sure that I recognize and thank our two Board of Education members. We already heard from Rosemary Eller, our president, and Cheryl Brady's here with us as well. And just if there's anything from the board, not that I'm expecting anything, but if there's anything from the board that we missed or any concerns, happy to give you the mic.
Thank you, Dr. Ricca. You know, I just want to say in this forum, feedback and questions are just so important. We need to know what you're hearing, thinking, and ideas. So please, 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 this is the forum. Definitely, as you represent all of our community, staff, and children, it's so important that we hear your voice. And on behalf of the board, I do want to say thank you for your continued participation, and to new members that have joined. Thank you so much.
I will just add my appreciation, you know, for everyone's participation, and you know that this is sort of a constant, you know, with us, that we are always thinking about this. We are always looking for solutions. And we are going to be, you know, listening to the science and making adjustments accordingly. But this is something that we are constantly considering.
Yes, amen. You're constantly, right? Constantly. Thank you very much, both of you. Thank you, and thanks for your leadership and your support. There were two questions that just came in. I want to make sure we hit them. Are we continuing to use bus cards? Yes. Lola, thank you for that question. And I'm right on that, right? Yep, okay. And there was another question from iPhone 2. Is there a plan for kindergarten should they need to go remote? Great question, because they've never done that before. Yeah, absolutely, yes. The same as we did last year with last year's kindergarten classes, we'll be able to implement that process with them. Refined, of course, because we learned a lot from working with our little tigers last year, but hopefully, and again, you know me, the eternal optimist. Hopefully we don't have to go down that road. We are definitely in a different place. You know, Kara mentioned something about our decisions, and I had made mention about this all the time last year. I'm going to continue to do it this year. Our personal decisions will impact our ability as a community to move forward toward progress. What does that mean? It means if you're sick, someone in your house is sick, your child doesn't feel well, your child wakes up and says, I have a tummy ache. These are big signs and big indicators for when you might need to keep your child home. Remember, oftentimes what we found in the past was that COVID-19 came to us. It was not something that erupted in our facilities. So we did a great job with that last year. Parents and guardians were super careful in terms of sending children to school. We're going to continue with that. We're going to continue with the attestations on how you're feeling, at least for the short term. And that's really important. The other thing that's really important too, and hey, I'm not pushing vaccination. I respect people's rights to get vaccinated or not get vaccinated. But there is no doubt that vaccination will help get us to a place where we're going to see less impact on a community scale of COVID-19. So, you know, things like having to wear masks or physical distancing or contact tracing and quarantine, those are all directly linked to our ability as a people to minimize the impact of this illness. This illness is going to be with us. We're going to have COVID-19 with us like we have the flu. Typically, pandemics burn out about 18 months, not with variants though. So, this is something that we have to think about. Again, like folks had mentioned, looking at the science. Well, this is not the first pandemic that we've had in human history. And so there are things that we can look at, but when there are variants involved, and when folks are making decisions that could potentially spread the illness, that's going to keep it going longer. Oh, hey, Kelly, your iPhone too. Thanks for being with us. Any other questions, comments, concerns, last minute for the committee?
Yep, just one more thing again, Dr. Ricca, thank you. Just in terms of Lola's questions about the Z passes, yes, they're going to be used, but they're not going to be redistributed. So the expectation is that the students held on to them since last year. So that's something that everybody should know. And that transportation, I don't know if Sergio's on, is not going to be sending out bus pass information in the mail, and that all of that will be available on the portal. So that's also new, particularly for elementary schools. So just to encourage parents to please access the parent portal and set that up so that you're able to get that information, because typically we haven't used the portal on the elementary level.
Great point. We're going to be trying to send fewer papers home as we progress and have more access to everything you need digitally. Now, we understand some folks need papers. It's no problem. We have them and we will send them, but we're trying to the best that we can get that at your fingertips on your device if possible. Lola.
Sorry, it wouldn't let me unmute. Are we going to continue to use like the smart button parent survey thing that we used last year?
We are, at least at the outset of the academic year, we're going to have those procedures in place. Much of the same health safety mitigation strategies that we had in place at the end of the academic year will continue to exist. Barriers will change a bit. Obviously, we'll be back in school. That'll be different. But yeah, most of the things that we've already become accustomed to will exist. Thanks, Lola.
Dr. Ricca, I just wanted to make sure that you know my position with cohorting. I feel that we still need to cohort. Yes, you might want to loosen the restraints a little bit, but cohorting is so important because then you're quarantining a lot less. And that means that many more kids will be going to school. If you start mixing everybody up, it's going to be a little bit of a mess because we will not know where those kids were sitting. So we might have to quarantine many, many, many more kids. And the goal is to minimize the amount of kids that we have to quarantine. So I think the biggest goal for me this year is to make sure that everybody knows where those kids are and who those kids are with so that we can minimize the quarantining.
So a great point to reiterate. Thank you, Nurse Maggie. And I think, Rob and Laura both hit on that very intelligently as well. What we can do ahead of time to try to minimize potential exposure, potential contact tracing, disruptions will definitely go a long way to assist. And I see, Melissa said the same thing, right? Assigned seats, knowing where our kids are so that circle of potential contact can be as small as possible. Absolutely. Now, Dr. Longobardi is jumping in right now, so she's going to wrap us up. Oh, I see Mrs. Buck, you had a question?
Yeah, I just wanted to get more clarification on the remote. So you said that there would be remote if it's necessary. Does that mean if the whole school district has to go remote?
So that would be like in a class situation. So if a whole, imagine an elementary class has to go remote, then we would be able to pivot. Everybody would be remote. Yeah.
Okay.
Right. Hopefully we're not in a whole school district.
Right. That's why I'm like, what does the remote mean? Because I know you said no remote, but in certain situations, I just wanted to get clarification. Thank you.
No, I think it's important. And thank you for making me clarify that. So for folks who are watching, we have the ability and will maintain the ability to pivot if we need to in an emergency situation to full remote. What we don't have the ability to do is kind of have that hybrid.
Back and forth.
Exactly.
Okay. Thank you.
Dr. Longobardi, thank you so much for taking time out of your day today. You're going to actually wrap us up. We just finished up. Our main consideration today was to wear masks at the beginning of the academic year when indoors, and the committee agreed that that would be the way to go. Any insights of what you're seeing from your office?
Yes. Hi, good morning, everyone. Sorry it's late. It's busy, busy in the office. A fair amount of sick kids, and the Delta variant is making its presence known over the past 2 weeks. So yes, back to really masking indoors. A lot of the precautions that we had let go by the wayside a little bit because things were looking so good. I think we're back to a lot of that. So I definitely would very much support masking indoors, everybody, regardless of vaccination.
Thanks, Doc. We are also, just so we're also sort of in a holding pattern, waiting for the New York State Department of Health to send out its updated guidelines. But we're in a very strong position district-wide to open up 5 days, full days, and we're excited about that.
Awesome. That's wonderful news.
Yeah, thank you. All right, everyone. So as I mentioned, unless there's any other questions, comments, or concerns, we'll get together again on Monday. It might just be for a couple of minutes, but I just want to make sure, in case I get something at 5 o'clock on Friday, as you know, sometimes they do, that we can pull together in the morning. And if it's quick, it's quick. And then we're going to populate your calendars we're going to stick with, and if this is a problem, just email Liza and myself. We're going to stick with that Wednesday, 9:30, every 2 weeks at the outset. If we need to meet more frequently, we certainly can. If things start to get really beautiful and wonderful and we don't have to meet as often, we'll do that too. So this is a very fluid, as always, very fluid situation. And a big thanks again to our new members of the committee. Really thanks for taking the time out and being part of this process. It's important. All good? All right, everybody. Remember, it is still summer, so enjoy yourselves. Have a good day.
Hi, Dr. Ricka. Thank you.
Thanks, Lola. Safe travels.
Bye-bye.
Thank you.